I've been a vet for over 20 years, and this is why we recommend that your dog is not overweight, especially not obese, prior to a general anesthesia and a surgery. One, the biggest thing, is anesthesia is simply safer in a leaner dog. When a dog carries extra weight and fat, it's harder to breathe, it's harder to ventilate, there's more work that its heart has to do, and having a lot of fat can actually affect the anesthetic drugs that have been given. It just makes everything so much more complicated and unnecessarily risky if it's an elective procedure. So if you're struggling with your dog's weight and you're thinking about maybe an anesthetic or a procedure in the future, check out our link below in Dogtopia. We have both our free Slim Dog Challenge, but also our Dog Weight Loss School, which has a done with you program with a vet nurse, and she can definitely help you get on track and lose that weight before the procedure. Check out the link below. 2, with surgery, having excess fat. Now, we don't have just fat on the outside of our body, but also when you're fat, you actually have a lot more fat on the inside of the body. And it makes things more difficult to see during surgery. It's harder to see things. There's more blood vessels you have to deal with. So you have to take your time more, and the risks can go up, as well as the anesthetic time. And the longer the anesthetic time, the colder they get, the higher the risks, and the longer the recovery. Basically, like a leaner dog just makes everything quicker and smoother. Third, of course, if they have any underlying conditions like heart issues or breathing issues or even organ issues, just carrying that extra weight just makes the body have more work. Like if you can give their body 25% more work that it has to do, where that energy could be spent healing and having a better immune system and recovering from surgery. So you're just kind of stacking things against you if you enter an anesthetic and a surgery already overweight. Finally, recovery is often better. It's quicker. I mean, your dog needs to get up, walk, heal, and that's just a lot easier when they're carrying less fat and less weight. Again, their hearts and lungs have less work to do, so their body can heal quicker. So if a procedure is elective, mainly a spay, for example, you really want to get in a good, safe body condition before you even think about undergoing an anesthetic, especially some breeds which are higher risk anyways, like your bulldogs. But sometimes you can't wait and surgery has to happen a lot sooner. For example, a cruciate ligament rupture. Now, the orthopedic surgeon will oftentimes still recommend weight loss for that, but it does need surgery kind of in the nearest future. But with every pound or every kilogram extra, that means that extra force is being borne on that leg that's just trying to heal. So your surgeon isn't trying to be annoying. They're just really genuinely trying to improve outcomes and reduce complications. At the end of the day, vets are not asking your dog to be a high-performing athlete. We're simply trying to have them have the best chance for a smooth induction, smooth anesthetic, an uneventful surgery, a quick recovery, and many more years with the people who love them. So if you're struggling with your dog's weight and you're thinking about maybe an anesthetic or a procedure in the future, check out our link below in Dogtopia. We have both our free Slim Dog Challenge, but also our Dog Weight Loss School, which has a done with you program with a vet nurse, and she can definitely help you get on track and lose that weight before the procedure. Check out the link below.